How do we explain vaccine-derived polio?
That happens only in places where you have low coverage, where you're talking 60% or low coverage. So the virus is excreted by kids who are immunized. Non-immunized kids pick it up. They develop immunity, but they will excrete it, and they'll be picked up by other non-immunized children. And this cycle will perpetuate as long as there are non-immunized children in the environment, right? So, and then this process could take much longer than 3 to 4 weeks. But during that process, some viruses will start changing, what we call mutating.
Yes, sir.
And somewhere along the way, when these mutations become significant enough, that weakened virus acquires the ability again to cause disease. Now, this doesn't happen for a considerable period of time.
We're looking at 12 months to
Much
more.
more. Much more. And so when that eventually does happen and the virus acquires ability to cause disease, and you see cases happening, but it's because of a vaccine-derived strain of virus, we call it a vaccine-derived polio case.
So in this particular case, the two cases we found in Laguna, I think in Lanao del Sur, these being vaccine-derived polio cases, these are a result of having significantly low vaccination rates.
Yes. And to give you context, both these cases that we've identified are linked to type 2 vaccine-derived virus.
Which was supposed to have been...
So that's what I'm coming to. Because globally we said we don't need type 2 vaccines and made a shift. So the oral polio vaccines since 2015 contains only type 1 and type 3. So Philippines or any other country has not used a type 2 containing vaccine in their routine immunization programs since 2015. So when the virus that was isolated in the kids was found to be type 2, it meant that this virus had survived in the environment in the Philippines from 2015 or before, right? So that's a minimum of 5 years.
5 years, yes.
And over that period, that weakened virus had been changing and acquiring capacity to cause disease. And this was because there was low immunity among some kids who were not vaccinated, and there was the opportunity for the virus to continue to circulate much longer than the expected 3 to 4 weeks.
Well, Doctor, I was looking at the figures that have been released by both government and WHO, and our numbers in the Philippines, as far as polio are concerned, are quite far from the 95% target. It's been dropping over the years. I think it's been dropping as early as 2012 when we had 88% immunization for polio. 2013 it was 84, 2014 it was 77 already, and going down to 2017 it was 74%, and 2018 66%. That's a far cry from 95, and it's been dropping for the past 5 years or 6 years. Why do you think that's been happening from your perspective?
So as I mentioned, there are multiple reasons. One is the logistics challenges, the shortages of health workers, but also other factors. Vaccine hesitancy has been growing not only in the Philippines but globally. There's been a movement to discourage parents from vaccinating their children, not only against.
Tell us about that. What exactly is? We've heard things like these. Sometimes they call them anti-vaxxers. I don't know if that's the proper term for it. What is the concept behind this belief?
So there's groups of people who believe that vaccines are not useful, that vaccines could actually be harmful, when the overwhelming global evidence is that vaccines have been tremendously useful in protecting and reversing many vaccine-preventable diseases. So, for example, we estimate that using the oral polio vaccines we've prevented more than 39 million cases of paralysis. So this is huge success, right? We've reduced the presence of wild poliovirus to 2 countries. And when groups opposing or circulating stories about the safety and efficacy of vaccines, this contributes to low uptake because naturally parents and caregivers are concerned about the safety of the vaccines.
And sometimes it breeds on superstition as well, and,
On-
and cultural fears.
Yes, but then the result of that is you have outbreaks like what you're seeing now, or the measles outbreak that you've seen. And you look at those and what damage that's done. The measles outbreak has probably resulted in 550 deaths now, right?
But doctor, what is the central argument behind these people who propagate this kind of information? Well, I ask you that because, of course, the best way to address the concerns that these people or the fears that these people raise is in understanding their argument or their point of view. I would think that that's the best way to fight that kind of propaganda.
I would probably agree, but I haven't, I mean, I'm not from that group, and there's multiple groups of people who discourage the use of vaccines for multiple reasons. Now, I'm not quite sure which of those groups are having the largest impact on the population in the Philippines. There are also groups which advocate that this is not natural. You shouldn't take this because it's not natural.
So it becomes a religious thing?
I don't want to be specific, but there's different opinions among the so-called anti-vaxxer groups on why you shouldn't vaccinate kids and protect them.